अरे भाई पीछे
ए गोविंद तेरा लाइट यार उधर कर तो वापस आके तक निकाल देखता हूं ये अभी तेरा हाथ आ रहा है अरे अपने सामने
थोड़ा पीछे हो जाओ, 1-1.5 फीट पीछे हो जाइए प्लीज। आपको सबको अच्छे फोटोग्राफ्स मिलेंगे।
हम लोग उनको रिक्वेस्ट कर रहे हैं अंदर से रिबन कटिंग करने के लिए, आपको फ्रंट शॉट मिलेगा रिबन कटिंग का। ओके, सो हम लोग सबको क्लियर कर देंगे। बी पेशेंट, दिस इज पेशेंट फ्लोर, प्लीज प्लीज।
आप इधर साइड पे
क्लियर 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 फॉर द मीडिया।
होल्ड करो खान
पेशेंट है अंदर।
तेरा नीचे करना लाइट
चलो भाई बाहर हो जाओ, बाहर हो जाओ।
So much sir for coming.
Thank you, sir.
And it's really encouraging for us. Thank you so much.
So just to make it clear, आप सब में से भी जो मेरी उम्र के हैं, सबका कुछ ना कुछ यहाँ पर 100% आप में से किसी ना किसी ने, आपके चैनल्स ने, आपके ग्रुप ने 100% यहाँ पर जो है चैरिटी दी होगी। बिकॉज़ एक टाइम था जब शुरुआत की थी हमने, तो हमने एक छोटा सा रूल बनाया था आप सबके साथ। आप बहुत सारे बहुत जवान हैं, लेकिन जो पुराने टाइम के होंगे उनको याद होगा कि एवरीबडी हैड टू पे 500 रुपीज़ चैरिटेबल वर्क के लिए इस हॉस्पिटल के अंदर। तब मैं इंटरव्यू करता था। अब तो मैं नहीं भी करना चाहता हूँ तो आप लोग कर लेते हो तो पैसे की बात ही नहीं रही। बट आई हैव बीन एसोसिएटेड विद द हॉस्पिटल नानावती फॉर ईयर्स। It started, the association started as a patient. Dr. Ali has looked after me in my various injuries. He's looked after my sister, my wife, and very few people know this, that when my third son was born, Abram, so he was very unwell, as some of you may know at that time, and he was rushed to the pediatric center here and looked after even before we could meet him. So it's a strange cycle कि जो मेरी माँ के नाम से जो वार्ड है, which they only with graciousness and gratefulness, I'm really grateful, उन्होंने अपनी मर्ज़ी से खुशी के लिए मेरी माँ के नाम से वार्ड को रखा, and my child was genuinely saved in this hospital, so I'm very thankful to you. And then today again with this new bone marrow transplant section that has been installed, I was made to understand by the very good doctors here that there are 10,000 cases which happen in India every year, out of which maybe 1,000 to 2,000 a year must be here in Mumbai itself. And this will turn out to be one of the biggest bone marrow transplant centers in the world, if at least amongst the top 5. Because of not only the fact that it's so advanced now, also I think what's important not only for India but for medical care, I think सबसे ज़्यादा important बात ये है कि वो जो है मुनासिब दामों में मिल सके. So I think that kind of stuff happening here, and wherever it happens, for me it is just a moment of happiness that I can be part of it. So there's no need to thank me. I'm here only because you save our lives. So thank you very much. Anything else anyone want to ask?
If you heal one of five, Quran says if you heal one of five human beings, you heal the mankind. Then you are saving everything. Questions?
Okay. When it comes to bone marrow, perhaps awareness is still not that high, I guess. So, what do you think about it? How aware are we Indians about this particular issue, about bone marrow transplant? How do you plan to reach out to the hospital?
I see, in the simple capacity, I can come here and think of myself as someone who's been honored and brought here. But these small gestures through yourself, me, all of us coming here, somebody will read about it, somebody will talk about it, And of course, there are awareness campaigns. I see lots of movie stars talking about organ donation. I think that's wonderful. So in whatever little way, I think public figures get a moment to talk about this or visit places. It's not just for कि ना हम यहाँ पर आ गए और रिबन काट दिया. I think इसकी वजह से दो चार लोग को और मालूम पड़ता है. Like I got to know so much. My parents have actually succumbed to cancer, so I should have known a little more. But I just got to understand from Dr. Saab, the senior Dr. Saab here, that how many patients are there in the country. Added every year 10,000. Thalassemia, children are, and many more cancerous patients. So I think all these things, and especially in our country with such a humongous population, I think these things are not only how many centers we make may still fall short for some years. So I think as much as we can encourage it through talking about it, telling people about it, and making it affordable, I think that's the most important part.
As someone who has such a global standing and being one of the biggest superstars of our cinema, do you think commercial cinema can be used to perhaps popularize this particular issue more, or do you think that's not possible?
To be honest, cinema is a very small part of all of this here. So in whichever way, I mean, whenever, I'm not going to say and talk about morbid stuff that, we'll start dealing with a patient in a movie who's got a disease like that. I mean, Allah kare kisi ko bhi disease now. And one never has to choose a protagonist like that. But I think whenever there are moments like this, I think the first thing that Indian cinema does, has been doing for years, in whichever method, is doctors को एकदम भगवान के बाद माना जाता है, दर्जा दिया जाता है. They're always the last hope and resort. And I think that itself is part of cinema which has been propagating that. And yeah, other aspects, I'm sure now, even with the younger filmmakers, when they're coming in, the research is a lot more. Those days are gone जब वो मैंने एक फिल्म थी उसमें ब्लड जो है एक दूसरे को हाथ से डायरेक्टली लगाकर. So I think just being able to show it properly, I think that itself is educated enough. And then of course there are people who would try and put it in films too. I've been coming to, like I said, Nanavati for 25 years here with my own injuries. My sister was here, admitted, as a matter of fact, just in the room behind. And to see it so beautifully renovated, and then especially the new technology that is being used, where they talk about this whole air suction thing to make sure it's hygienic and sterile. I think those things are great innovations. I've seen this hospital for 25 years, so to see it now like this and develop to such an extent, I think it's a great thing you all are doing, because at the end of it all, you don't come with any happy feeling to a hospital. So if the hospital can make you feel nice and comfortable for whatever little stay, inshallah nobody has a long stay. But I've had very long stays in my family. Like I was saying, when the pediatric ward was being made, so Ali had asked me, how should it be? I said it should be like a playground. Please make it like a playground. So when you go there, the little children are there and you don't feel. So I think the atmosphere, the hygiene, the sterility and everything that is being managed here is, I think, world class, mashallah.
Shahrukh, injuries have been part of your life, and you've always recovered beautifully. But has it ever been a time when it has slowed you down mentally, affected you that okay, let me not take risks with my health, in my body while working?
I think the strange thing is I've never really got injured doing something dangerous. I'm a romantic hero. While loving only, I'm getting injured. I'm making love and I'm getting injured. It's whatever big injury. Now I have a bad knee. It was just during a dance. Not even some big. The big stunts I've done, I've got actually. God's been kind.
No, the jump, first floor jump.
Some jumps and all.
He has
Yeah.
paid the stuntman and he has done it on his own.
Even if it's not during work, but as a person, as an actor, did you feel that okay?
No, not at all. Yeah. I really feel that if you can go, and I'm not a how do you say, surgery junkie. I've had 9 or 10. I've just had one. I still have to take my stitches off. I think if you can go to your doctor and trust in him or her, I think that's the best thing you can do. Get rid of ailments. Do regular checkups. To all of you, matlab, you spend as much time on the road as I do. All of you are running around. Day before yesterday, one boy. Please be careful in front of cars. And do checkups, do yearly checkups, please. I mean, for young people, for old people, we don't think as. I think somewhere we people have not got into that culture of doing yearly checkups. So, सब ठीक चल रहा है यार. खाना वाना खा लिया, थोड़ा सो गए, सब ठीक हो गया. I think we should do yearly checkups and put yourself in good doctors' hands. And most of them are all good people. They look after you and you can come back
Insurance
bouncing.
available.
And insurance also.
Yeah, insurance available. So they
And there are insurances available now, so you should participate in all that and do it for your family, for your kids. I think it's important.
शाहरुख, इसके अलावा आईपीएल शुरू होने वाला है तो किस तरह की प्रिपरेशन चल रही है, किस तरह की एक्साइटमेंट है?
मैं तो क्या प्रिपेयर करूँगा यार, मैं तो टीम प्रिपेयर हो रही है. आई थिंक चूज़ हो गए और अभी अब चले गए होंगे लोग. आई थिंक ट्रेनिंग के लिए साउथ अफ्रीका 10-12 प्लेस जा रहे थे. आई थिंक कल परसों में चले जाएंगे. किस तरह का विश किया? मैं तो गले ही मिलता हूँ सबसे यार. उनका जन्मदिन था, उनको बस विश करने एंड टाइम स्पेंड करने चला गया.
Shahrukh, a lot's been spoken about your growing friendship with Amir. So can we see a film in the pipeline, perhaps, with you and Amir starring together in it?
No, we don't have any. We don't talk work here. We haven't spoken work for years. So I think he's just been in town. I've been in town, and last 2-3 months I think he's come home sometimes. But no, we've not talked work at all here. There's nothing work-wise that we have discussed.
Shahrukh, also one of the biggest films with a medical background that has been made in Indian cinema was Nanavati MBBS. It was planned with you. Raju had planned with you. Didn't happen. So any regrets on missing that out, or perhaps?
I think यार हर किसी की फिल्म जो होती है उसकी किस्मत की होती है. And I don't think I would have done it as well as Sanjay Dutt at all. I think he was fantastic in the film.
Shahrukh, related to what he asked about Amir, how has your friendship evolved with him? Because earlier when we used to see you guys together, of course you guys must have been meeting personally, but we didn't spot you guys together.
We actually always met as often. You just have more media now who gets to know that we are meeting. हम पहले भी इतना ही मिलते थे तब, लेकिन चले जाते थे. अब तो actually it's quite shocking that everyone is everywhere, so that's why I think it seems more like it.
Yes.
Guys, we need to wind up. Thank you.
Okay. Excuse me. I'd like to thank Shahrukh Khan ji and also want to share with you that this is such an important milestone. Many of you may not be aware, but the Bhumi Pujan of this hospital was done by Mahatma Gandhi along with Khan Abdul Ghaffar Khan.
Oh wow!
And
That's
the
amazing.
inauguration of the hospital was done by our first Prime Minister Jawaharlal Nehru, Pandit ji. Thereafter, Mother Teresa inaugurated the cancer ward. J.R.D. Tata also inaugurated a ward. And today, sir, you have inaugurated this thing. It is such a tremendous honor
They
for
must
us.
have been better dressed than me, I'm sure. But thank you so much.
Thanks.
Thank you.
Thank you guys, girls. Thank you very much.
All the nurses.
Thank you. Thank you, all the best. Thank you for having me. Thank you. Thank you, Dr. Sir. Explaining all that. मैं आके और समझूंगा फिर मैं definitely sir मैं patients होंगे तो मुझे मालूम है वे send them.
What do world class will offer?
No. And I'll come and discuss my foundation.
Anytime you give me the time and
Can you
place,
give
I
me
will be
3-4
there.
days? I'll just sit with
I'll
Gitika
find
and
it's convenient.
Come on. Thank you guys. Thank you very much.
रवि हम इसको आगे लेना भाई.